This one. This. Think about the case. Who is obstetrician here? Raise up your hand, the obstetrician. Excellent. Look at this. I will give you a history here. I think this structure looks like a cyst. But let me tell you the history. This patient, she underwent total hysterectomy 2 years ago. Total hysterectomy. And she came now with pelvic discomfort. When you scan, you see this. Who can tell about this?
This look like
whenever you scan, you see this. You are walk and go to the bathroom and empty the bowel and everything, and she comes back, you see the same image. And the history that she underwent total hysterectomy 2 years ago. The complaint is pelvic.
Second urinary bladder.
What is this?
This is urinary bladder. Yeah.
This is urinary. Okay. And what is this?
Mirror image of UB.
Mirror image of what?
Urinary bladder.
How it comes? Let me ask a question. Brainstorming. That's why I say please keep your cameras open. The patient is sleeping on the bed, right? On her back. And this is a full bladder. What is this?
Full bladder. Wall, the wall of the bladder.
You can't see the wall of a bladder if there is no uterus. She did hysterectomy. And this is a very hyper-echoic structure, very big.
Bowel.
There is no bowel. The bowel of the sides. And this was transverse. What is behind the bladder? Imagine with me. She did total hysterectomy. And she's lying on her back.
Rectum? You mean rectum? Rectum is so.
No. This was the coccyx bone. This was the coccyx bone. When the bladder is overfilled, it will fill the pelvis cavity. No bowel, no rectum, nothing. Just lying on the bone, on the coccyx bone. So this was the coccyx bone. So what after the coccyx bone? The bed. So what was this darkness? What I call it shadowing. This is shadow from the coccyx bone that appears black. So what is this? Now, imagine, let me discuss it. Imagine now, the sound that comes to the bladder, it reached the coccyx bone so fast because it is not attenuated by the uterus. The uterus is not there. And this bone reflects about 90% of the sound back to the transducer. Now the transducer reflects the sound again. But now it's a big distance that I call it big ambiguity. So it took longer time to be represented again. All the way. Now this is another coccyx, which is an artifact. So this is another coccyx. Mirror. What we call it long-range reverberation. So this was shadowing. Now, this was in a public hospital where there's a lot of doctors, they are manipulating the gain. Some doctors are playing with the gain here and here, and it produces some brightnesses here, some brightnesses here, that makes all this area appears as cyst, and this second bone as enhancement, cyst. From where the cyst comes? No cyst.
Yes.
I sent her back. with the same images they have taken. And this was her case. Here's
Yeah.
this is what they have seen. And
Yes.
tell me, for sake of God, from where the cyst comes. This is the coccyx bone, nothing
Yeah.
after that or distal to this. It is the bed. Now this is shadowed from